Hello everyone, this is Chadi Alraies from SCAI 2023 in Phoenix. I'm really privileged today to be with Dr. Jay Mohan. He is a phenomenal friend and interventional cardiologist in Michigan, and he has been doing a lot of work in the VTE or venous space and becoming an expert in the field. Jay, always nice to see you.
Yes, you too, Chadi. Thank you for being here.
So tell us about, we're going to talk about interventions, but how did you build a program as robust as you have and kind of as a kind of a role model for the people in Michigan?
You know, fortunately, I had the ability to be trained in venous intervention in my fellowship, which is kind of unique.
Yes.
I give it props to Herman Cato out of Beaumont that really taught me what I know. But a lot of it has to do with most of our cardiovascular patients have some degree of venous disease. So I believe as a full cardiologist and a full operator in the peripheral disease space, you have to have some knowledge of the venous disease space.
Absolutely, yeah.
Many people have venous deficiency, unhealing ulcers. One of the most common, consults you get as a cardiologist is unexplained edema, right? Yeah. So you're going to run into DVT. You're going to run into PE. I've really found a niche by doing it mainly because nobody else wanted to.
Yes.
And there wasn't a lot of people, at least in Southeast Michigan, that were escalating DVTs to mechanical thrombectomy. And lytics still weren't doing the best job, so there was an unmet need in our patient population, which is why I think I was able to do that.
Yeah, absolutely. And then in terms of intervention, you mentioned you trained by it, but there is a lot of centers, not everybody trained in it. So how can somebody get this skill set on practice?
So honestly, I have to give industry a lot of support. They've been very good at supporting our cases, coming up with actually devices that are user-friendly. The world of Twitter has been actually very helpful in this space as well, because we're all kind of learning together. But honestly, I think you could be proctored maybe the first 3 cases, but a lot of the same skills. If you're a peripheral disease operator, you should know how to use certain catheters, certain wires. There's really not a lot of details with that. In some of the chronic venous disease space, there's a little bit more nuance to it, but for the most part, acute DVTs should be able to be treated by any cardiologist that does peripheral vascular disease.
So one of the also things that interventional cardiologist looks for is define a niche, and this is a different niche. So how do you brand yourself so you can attract referrals in that space?
So
a lot of social media stuff. They see your phenomenal work, very educational. But one of the tools is this. But what else people should think of?
I think one of the best things that I did was early on I went and talked to podiatry and family medicine. They tend to see those patients early on. They're the ones that are prescribing compression stockings, lymphedema pumps, and I went and told them that, hey, I have this niche that I can potentially treat unexplainable edema and help you have your patients live a better quality of life. And then when they first saw that I was able to do this, and the results are pretty amazing, the improvement in quality of life for their patients, that it's an automatic referral after that.
Absolutely, yeah. So building a good skill set, again, having good results and build that referral base is the way to go.
Yes. Yep.
Well, always nice to talk to you, Jay, and please watch his videos and others on SCAI TV. This is Chadi Alraies from Phoenix from SCAI 2023. Jay, thanks again.
Awesome. Thanks, Chadi.